What brought you to Balance Physical Therapy?
Well, initially, it was 6 years ago where my hips were so uh, bad. I was in so much pain and my mobility was so restricted, and the things that I needed to do and like to do were stopped. And so unless I had my knees replaced, then I would pretty much be in a wheelchair. And now, uh, during the last year and this year, my knees also were pretty bad from osteoarthritis. And a lot of that was through the kinds of activities I did when I was younger. I did a lot of long distance running, marathons and ultra marathons and triathlons and a lot of other shorter races, and that caused a deterioration of my knees. And so I had to have those replaced as well.
How long ago were those replaced?
Well, my right knee was replaced about 11 and a half months ago, and my left knee was replaced about 9 weeks ago.
Fresh.
Yes.
Fresh. So how has therapy helped you get a quality of life back again?
Well, that's very important, getting your quality of life back. It means a lot to me, and means a lot to everyone. And what I don't know if you were asking what I'm doing here that has helped to improve that. Well, my therapist, Dr. John Schatz, has been utilizing a lot of what you called pushing, stretching, pulling, strengthening exercises that help to improve not only the straightening of your knees, but also the bending it forward and being able to have better range of motion or flexibility, where you can bend your knee without being stiff like a Frankenstein, and causing a greater improvement in your knee so that you can do the things that you need to do at home and other extracurricular activities that you like to do.
Now, in your own personal experience, do you know any people in your same, I would say, boat that's had injuries to their lower extremities where they should get therapy and haven't gotten it?
Yes, I have some acquaintances and friends at the golf course where I play 3 days a week, and they're in the 60 to 70, 75-year-old range, and some of them have procrastinated about getting it. I don't know why. It may be because they don't have the insurance, the supplemental insurance needed. It may be because they're just afraid to get it. It's a pretty daunting experience to have surgery, because there's a lot of risk involved. There's some risk involved, at least, in the surgery, and then afterwards there's a lot of hard work and pain that you have to go through to be able to become successfully mobile again. So those are the reasons why, but I can see that it's bothering them because they're either limping, they're in pain, or they're unable to do things by themselves. And then they become very self-conscious of this as well, because they know that other people see this, and nobody wants to ask for help, on things.
So you can say your experience here at Balance has been a positive one.
It has been, there are little things that people take for granted when they're healthy and they're physically able to do things. Simple things just like sitting down in a chair to eat or watch TV, or your daily toilet needs, or things like housekeeping or doing yard work, or doing, like I said, extracurricular activities like playing golf or hiking or walking. You can't do those things during the time that you're having pain. and you're struggling to move. And so it also causes an emotional, a negative emotional being. You can be discouraged, you can be demoralized, you can be depressed from all of that, and sulk into, just isolation from your friends and your family as well. And none of that is healthy. So, having the surgery done to correct things if it leads to that, and then accepting the physical therapy as a way to improve your mobility and your overall health is something that you have to agree to. And it's when you do it, you have to be disciplined enough. You have to be committed. And the difference between that is that the commitment is that you have to commit yourself to going to therapy, and discipline, you have to do those things that you're asked to do. You can't cheat your way out of this. And then you have to have a sense of perseverance, because you have to understand it's going to take a while. You have to be patient with yourself and understand that just small incremental victories, of progress is leading to the ultimate goal of getting healed and rehabilitated.
Absolutely.
So it's very important that you do all those things.
Well, my friend, it's been a pleasure watching you improve every single day I see you in here. And you're a motivation to myself and many others in here. And I beg you to continue to keep trying. There's going to be good days and bad days, as we all know.
Mm-hmm.
Just keep pushing forward.
Well, thank you. I saw my doctor yesterday, and he did are you okay there? A 9-week evaluation on my left knee. And even though there's only some incremental gains on the flexibility, the flexion, the range of motion, there's major gains in moving the knee forward, and major gains in straightening the knee, and major gains in the strength of my quadriceps. So he was very generous in recommending 6 more weeks of physical therapy, which I happily accepted, because I want this to be 100% in shape when I start getting back to doing the things I want to do again.
It's going to happen.
Yeah. A lot of hard work.